Magandang hapon po sa inyong lahat. Narito po tayo ngayon sa ating Beat COVID-19 Virtual Presser upang maghatid ng updates tungkol sa ating sitwasyon at sa laban natin kontra COVID-19. Sa ating pakikipaglaban sa pandemyang ito, mahalaga na ang ating mga programa at interventions ay nakabase sa latest scientific evidence. Tandaan po natin, bagong virus po ang ating kalaban at walang kahit sinong bansa ang mayroon ng kompletong impormasyon ukol dito. Kaya naman, araw-araw, meron po tayong bagong natutuklasan na kaalaman ukol sa virus. Kapag ang ating mga programa at inisyatiba ay science-based, nasisiguro po natin ang ating mga health facilities, pati ang ating mga frontliners ay mayroong fighting chance laban sa COVID-19. Sa ating munting pamamaraan, tayo ay may maiaambag upang maprotektahan ang ating mga frontliners laban sa COVID-19. Sa ating mga tahanan, ang pagtiyak na nagagawa natin ang ating mga tamang health protocols ay makakatulong ng malaki sa ating mga frontliners na mananatiling ligtas din. Upang masigurong meron tayong malaking fighting chance ang ating mga frontliners sa COVID-19, walang tigil ang DOH sa pakikipagtulungan sa mga local at international organizations upang mabigyan ang ating mga bayani hindi lamang ng sapat na training, kundi pati angkop na kasangkapan o equipment sa pagharap nila sa virus na ito. Hindi magagawa ng DOH ang lahat ng ito na mag-isa. Kapartner po namin ang WHO, ang UNICEF, ang USAID at PhilHealth upang mabigyan ng proteksyon ang ating mga healthcare workers na nangangailangan ng ating kalinga habang patuloy silang nakikibaka sa frontline ng World War C. Ngayong hapon po, makakasama natin ang ilan sa ating mga partner organizations upang mapag-usapan ang mga programang naglalayong suportahan ng ating frontliners. Ngayong hapon, makakasama po natin unang-una ang WHO, si Dr. Takeshi Nishijima, WHO Technical Officer from the Western Pacific Regional Office. Makakasama rin po natin si Dr. Wishdan Madani ng UNICEF. She is the Chief of Health and Nutrition of UNICEF Philippines. Makakasama rin po natin ang atin pong kasama from PhilHealth, si Dr. Gigi Domingo, Vice President for Corporate Affairs and the PhilHealth spokesperson. Para ipaliwanag po sa atin ang kahalagahan ng infection prevention and control sa pagproprotekta ng ating mga frontliners, we have Dr. Nishi of WHO to share a brief statement discussing its importance and relevance. Good afternoon, Dr. Nishi.
Good afternoon.
Yes, you'd like to give a message to our viewers and listeners regarding infection prevention and control.
Hi. So thank you so much. This is Dr. Nishi from the Regional Office of the Western Pacific. I would just like to address how important the IPC is, especially for the healthcare workers, but also in the community and the other settings as well, in order to prevent the spread of COVID-19 transmission. As we know, the COVID-19 will spread mainly by the droplet, meaning the when one touches, the expels, and the other people can be infected from that droplet. Or sometimes can be sometimes touch the droplet and also touch their nose or mouth. The person also can be infected. So we know the route of the transmission, meaning that we know also how to prevent this transmission. So that I would I would very much stress that knowing the IPC and appropriately practicing the IPC is very important to protect healthcare workers and other people. Thank you.
Thank you, Dr. Nishi. So now we ask you, a lot of people think that protecting healthcare workers only means providing them with the necessary personal protective equipment. Can you share with us what other facets are in the holistic approach that we employ to protect healthcare workers? Dr. Nishi?
Okay, thank you very much. I would like to raise 3 points. So as I said, if we practice appropriate IPC practice, including the usage of PPE, we can prevent the infection. Because this COVID-19 can transmit by droplet and also contact, what we recommend is to practice droplet precaution and also contact precaution, meaning the PPE we recommend is a surgical mask, eye protection, and then gowns and gloves for the healthcare workers who are directly taking care of a COVID-19 patient. However, as you mentioned, only using PPE is not enough. Perhaps more important is to appropriately use PPE in addition to practicing appropriate IPC measures. Especially, I would like to focus or emphasize the importance of practicing appropriate removing of PPE. I mean, we call it like a doffing of PPE. When you take off your PPE, you need to be trained to do that. And also you need to be very carefully do that. Because when you are doffing PPE, you have high chance that you might be contaminated by the virus. So, for example, before and then during and after removing PPE, you need to practice hand hygiene, meaning that you need to wash hand, preferably with the alcohol-based hand rub. Other healthcare settings, what we recommend is the usage of alcohol-based hand rub rather than using the water and the soap if alcohol-based hand rub is available, because it is more efficacious and it is more faster. You don't need to dry your hand like when you wash with water and soap. So this is the one thing I would like to very much focus on. Another point I would like to say, in addition to the PPE, is the importance of investigation and also contact tracing when you see the infected or suspected case of healthcare worker at the health facilities. You need to identify the source of transmission, how this person was infected. So you can take a precaution measure to prevent the further transmission. Also, you need to do the contact tracing when you see the suspected cases. So who is exposed to this person during the period this person can be infectious? So the people who are the contact of these confirmed or suspected cases can be quarantined immediately to prevent further infection. And then if you see any factor or gaps which led to the infection of the healthcare worker, you need to immediately fix it so that you can prevent a further infection. Yes, so this is the 2 points I would like to mention. Thank you.
Okay, thank you, Dr. Nishi, for that. So that is very important, the answer of Dr. Nishi, because he has emphasized that it is not just having the PPEs, but how you don it and how you are doffing it. Doffing is doffing means that when you remove the PPEs, it further increases the risk of our healthcare workers into these infections if it is not properly done. Also, Dr. Nishi has mentioned about hand washing and also contact tracing. So wearing PPEs will not be very significant if you will not practice the other measures that is being implemented for us to prevent infection among our healthcare workers. So, Dr. Nishi, how would you assess the IPC measures that are being implemented in our country, and how would you rate it compared to the IPC measures in other countries?
Okay. Yeah, thank you very much for the question. Indeed, it is very, very difficult to compare IPC practice with the other countries. But what I see from almost everywhere, including Philippines and other countries, is the compliance of hand hygiene, the hand wash, is almost always suboptimal everywhere. So, for example, WHO recommends like a hand wash 5 moments. This is the moment you need to wash hands. And then in addition to that, I would emphasize the importance of hand wash as, you kind of described when you doff the PPE, when you remove PPE. However, to be able to wash hand, it's ideal to have alcohol-based hand rub almost everywhere. Ideally, at every patient room, and then also every treatment area, so that the people can easily wash their hands. I don't think I can emphasize enough the importance of hand hygiene and then appropriate frequent practice of hand hygiene. And in addition to the, for everyone, it is important to practice other IPC measures. For example, like keeping physical distancing, and then also practicing cough etiquette, and then don't touch your mouth or nose or your face, to prevent from infection. So thank you.
So thank you, Dr. Nishi. I agree with you. Hand washing and the other measures like physical distancing is really very important in preventing infections among our healthcare workers. So let me get back to you in a little while. I'll just talk to our other guest. Ngayon naman po, ibahagi natin kung ano-ano naman po ang programa ng UNICEF in relation to healthcare workers' protection. We have now Dr. Wishdan of UNICEF. Dr. Wishdan, good afternoon. Dr. Wishdan. Dr. Wishdan, good afternoon. So habang pong inaantay natin si Dr. Wishdan na mapaere, tanungin po natin uli si Dr. Nishi. Dr. Nishi, may I get back to you now? How significant is it for civilians to still stay at home even with the lifting of ECQ to MECQ in some areas, observe self-quarantine, and to keep practicing behavioral changes while we wait for a cure and vaccine against COVID-19?
Okay. Thank you very much for the question. Yes, I would still say it is very important to stay at home for the people in the public to prevent the further spread of the infection. As we see in the number of newly reported cases in the Philippines is not, rapidly decreasing even after the strict implementation of the community quarantine. And then, still, I think we need to be very careful. If we stop, staying at home and then stopping the other measures for the prevention, we might still see the explode of the, increasing number of new cases. So I think at this stage, it's very, very important for us to be aware of that potential of having the large number of new cases again. So I personally think that it is very important to stay at home as well as practicing other non-pharmaceutical intervention measures like physical distancing and then cough etiquette and then those kind of things. Thank you.
Okay, thank you, Dr. Nishi. So how can then now the public support other strategies that we employ in our response against COVID-19, such as contact tracing and isolation? How do you think can the public help in these facets of the response, Dr. Nishi?
Sorry, you mean the public or public health?
The public support. Like, for example, for contact tracing, we don't need to go to the communities and find you. You can voluntarily call us. So what can you say about that?
Okay. Yes. The importance of contact tracing and then, for example, quarantining the contact, it cannot be overemphasized. As I understand, this is, like worldwide, this is one of our main strategies to contain the spread of COVID-19 outbreak. So, it is not easy for all of us to continue this effort, like staying home and then cooperate with the quarantine, the contact tracing. But I think this is a very, very important moment for us to continue to cooperate with the public health authorities and then local government unit to continue our practice, as well as community quarantine. Thank you.
Okay, so Dr. Nishi, what would be your final message to our listeners and viewers who are now watching and listening to you? What would be the message coming from WHO regarding our response to this pandemic?
Okay, so thank you very much for the question. Yes, in the Philippines, we are seeing the new number of cases, and then which is kind of stabilized a bit. We are hoping that it will decrease in the future, But for that, I think we need to be prepared to continue what we do right now. As said, stay at home and then practice physical distancing, cough etiquette, and then frequent hand wash, those kind of things. It is not easy as the time is getting long for us to be practicing all those things. However, I think that this is a very, very important moment for us. So it's very important for all of us to, fight together against this COVID-19 outbreak. And I would like to say that WHO is very much committed to continue to support the Philippines and the DOH and the people here. So thank you very much.
Thank you very much, Dr. Nishi, for all of this information that you have provided to the public and, of course, for guesting here in our daily presser. We hope that we can have you back again. Thank you very much. So ngayon naman po ay dadako tayo sa pakikipag-usap sa ating kaibigan coming from UNICEF, Dr. Wishdan. Dr. Wishdan. Dr. Wishdan?
No, I cannot hear you.
Good afternoon, Dr. Wishdan. Can you hear me now? Dr. Wishdan?
Yes, I can hear you now.
Okay, that's good. How are you? Wishdan?
Yes, I can hear you now.
Okay, how are you?
Yes.
Okay, these are our questions for UNICEF. The first question, Dr. Wishdan, how are programs supporting other frontliners such as those doing contact tracing? Is UNICEF doing anything to add support for DOH into for our contact tracers in the communities?
Good afternoon. Yes, UNICEF is supporting the local government units and also the Department of Health in the efforts for contact tracing. Our main support really is focusing on training contact tracer as part of the infection prevention and control training that we are rolling out, which has components on contact tracing to really help them and build their capacity on doing it in a proper way. We are also providing some PPEs to ensure also their safety and to protect them from the infections. The trainings also for the contact tracing have some components on case notification pathways. It also includes the role and responsibilities of the barangay health emergency team, and as well as it's also training them on the sign and symptoms for monitoring of those at facility or community quarantines.
Okay, Dr. Wishdan, thank you. Thank you for that answer. So there's another question here where we are asking about the other healthcare programs that need to continue. Like we all know that immunization has to continue for all of our children. So where we have healthcare workers also in the front line. So how does UNICEF support our healthcare workers doing immunization in the field?
We are really working very closely with the EPI team in DOH to ensure the continuity of the immunization program at the local government units. Our support is mainly helping them in finalizing all the guidelines for to continue the routine immunization in the context of the COVID. In addition to that, also, and this is part of our ongoing support to the Department of Health, is the procurement of vaccines, mainly through UNICEF procurement services, and this is mainly for polio and measles vaccines, for routine and also for the planned campaigns. As you are all aware, that the polio campaign had been suspended because of the COVID, and we are really now working closely with the government to prepare for the campaigns to happen in the near future to really stop the transmission of the polio in the country. And we will also continue our efforts in supporting the governments on the community mobilizations, awareness raising, and risk communications on immunizations. And this is, as I mentioned, is part of our continuous effort to support the government in immunizing.
Thank you very much for those answers, Dr. Wishdan. Would you like to share with us, with our viewers, your final message? What can UNICEF share to our televiewers regarding their program for the pandemic, for the response and the support to DOH in our response to COVID-19? Dr. Wishdan?
As you are aware, that UNICEF are the UN agencies that deal with the children, are responsible for the children, and we know that COVID epidemics is affecting the children in different ways, and we are really working with the governments and the Department of Health to ensure the safety of the children and also the families. And our support is extended also to risk communication, community engagement, working using different platforms. Our reach has been really huge. We reach around almost 66 million through messaging using different social media platforms. And also we put a lot of efforts to work closely with the communities in hard-to-reach area also to reach them. The key message is that in addition to what the WHO colleagues mentions on keeping physical distancing, frequent hand washing, and also coughing etiquette, I also like to add also the importance of eating healthy food and feeding also our children healthy food, and the importance also of exercising. And in addition to that, we also really encourage our LGU to continue the essential health and nutrition services, because this is really critical to reduce also mortality and morbidity among children. Thank you.
Thank you very much, Dr. Wishdan. Thank you for guesting in our virtual presser. And thank you also for all the support that you provide, UNICEF provides to the government. So ngayon naman po, para pag-usapan po ang ating financial support na ibinibigay ng ating gobyerno sa ating mga frontliners, kasama po natin uli si Dr. Gigi Domingo ng PhilHealth. Dr. Gigi, good afternoon po.
Hello, good afternoon sa iyo, Yusek Verhere, and good afternoon sa lahat ng nanonood at nakikinig ngayon.
Tanghapon, Dr. Gigi, umpisan ko na po yung tanong natin sa PhilHealth. Paano po ba daw ma-avail ng ating mga frontliners, mga healthcare workers, kasama ang mga pulis, mga barangay tanod, mga grocery workers at iba pang frontline natin ang health coverage ng PhilHealth? Dr. Gigi?
Okay, yung coverage kasi ng PhilHealth ngayon ay one, yung inpatient benefits. Ibig sabihin nun kung ma-hospital dahil sa COVID, ay meron tayong mga benepisyo para dyan. Para sa ating health workers, defined as all health workers including personnel, support and admin, the doctors, the nurses in health facilities, in government health agencies din, ay libre po lahat. This is also in consistent with the Bayanihan Health We Heal as One Act, no, na lahat ng health workers ay dapat sagot ng PhilHealth. So sagot po natin yon. So yun, and we also have testing testing benefits. So meron po tayong linabas dyan na case rate, and meron rin tayong MOA with the Philippine Red Cross para doon sa testing of targeted population as per the Department of Health memo. So yun lang po, yung kailangan po mag-avail ay pumunta lang po doon sa PRC, sa Red Cross, or any other DOH laboratory na accredited by DOH. And dapat nabawas na doon ang benefits ng PhilHealth. So yun po.
So, Doktora, gaano naman daw po kabilis ang pagpoproseso ng mga dokumento bago po nila matanggap ang PhilHealth assistance?
Actually, ang mga pasyente or ang mga members po natin, hindi sila ang dapat mag-file ng claim. So dapat kung i-avail nila yung benefit, kung inpatient man or testing benefit or even the community isolation units, yung mga na-isolate po doon, meron rin tayong benefit doon. Kung mag-avail po sila noon, dapat pag-discharge na o pag natapos yung, kunyari yung test, kung matapos yun, ay dapat binabawasan na kaagad. Hindi sila magdi-direct file sa PhilHealth. Binabawasan na yan kung saan sila institution pumunta at yung institution na yon ang magpa-file ng claim sa amin.
Okay, so katulad ho ng sinasabi ni Dr. Gigi, lilinawin lang po natin sa ating mga kababayan, hindi po kayo ang kailangang magproseso ng inyong mga dokumento. Pag pumunto po kayo sa ating mga laboratorio, sila na po ang kailangang makipag-transaksyon sa PhilHealth. At pag dumating po kayo doon, naka-charge na po sa PhilHealth kung ano man pong test o di kaya serbisyo sa ospital ang kailangan nyo. So, Doktora, last question lang po. Kung meron pa hong karagdagang tanong sa PhilHealth ang ating mga kababayan para sa PhilHealth assistance, saan po sila maaring tumawag?
Tumawag lang po sila sa ating Action Center. Meron tayong 24/7 na Action Center. 8441-7442. Meron rin tayong cellphone number. Ito, kunin po nila, 0921-630-0009. Ito ay pwedeng mag-call back po ang ating mga agents po dyan.
So thank you, Dr. Gigi. Uulitin ko lang po yung mga numero. So kung kailangan po ng PhilHealth assistance ng ating mga kababayan, maaari po silang tumawag sa 8441-7442 at sa cellphone number 0921-630-0009. So yun po yung mga telepono na maaring tawagan 24/7 para po sa PhilHealth assistance. Dr. Gigi, maraming salamat po uli sa pagpaunlak sa amin dito po sa ating guesting sa ating virtual presser.
Salamat din po sa pag-imbita sa amin.
Thank you very much po sa ating mga partners sa labang ito. Maraming salamat po sa mga suporta sa ating mga healthcare workers. Mapalad po ang Department of Health sa pagkakaroon ng mga kabalikat sa World War C na katulad ninyo. Tinatawag po nating mga bayani ang ating mga healthcare workers dahil tinataya po nila ang buhay nila sa bawat sandaling inaalagaan nila ang isang COVID patient. Maari po ba nating ipaalala at maging inspirasyon sa atin itong ating mga frontliners? Samantalang meron tayong mga ayudang ganito galing sa ating mga partners, tayong nasa bahay ay makakatulong ng malaki sa ating mga frontliners sa pamamagitan ng palagiang paghuhugas ng kamay, cough etiquette, pananatili sa bahay at pagsusuot ng mask kung kailangang lumabas ng bahay. Ang pagpapanatili ng magandang kalusugan ay makakadagdag ng proteksyon sa ating pamilya at sa ating mga bayani. Ngayong hapon, tunghayan naman po natin ang updates tungkol sa COVID-19 situation sa ating bansa. As of 4 p.m. today, May 26, meron po tayong naitala na 350 na bagong mga kaso ng COVID-19. Ang total number of cases po natin ngayon ay 14,669. 89 po ang bilang ng ating mga kababayan na nadagdag sa mga nakarecover. Kaya't sa kabuuan, meron po tayong 3,412 recoveries. Kasama po sa mga nakarecover ay ang mga pasyenteng nakakonfine at mga pasyenteng may mga positive at mild asymptomatic cases na nakarecover mula sa kanilang self-isolation at home quarantine. Ngunit 13 naman po ang nadagdag sa bilang ng ating mga kababayan na pumanaw dahil sa sakit na ito. Ang kabuuang bilang ng mga nasawi sa bansa ay 886. Para naman po sa updates on our healthcare workers. Makikita po natin sa screen as of May 25, meron pong 2,420 healthcare workers na nag-positive sa COVID-19. Out of this, nakapagtala po tayo ng 1,163 na healthcare workers na nakarecover mula sa COVID-19. Base po sa datos natin, paunti ang naitatala nating mga healthcare workers na nagpo-positibo. Ang atin pong active cases para sa mga healthcare workers ay 1,226. Ibig sabihin, patuloy na tumataas ang bilang ng ating mga COVID-19 survivors mula sa hanay ng ating mga healthcare workers. Malugod naming ibinabalita na wala tayong bagong naitalang healthcare worker na pumanaw dahil sa COVID-19. Nananatiling nasa 31 po ang bilang ng mga deaths among healthcare workers mula pa noong May 10. Inyo rin pong makikita sa graph na ito ang patuloy na pagbaba ng mga bagong kaso ng COVID-19 sa ating mga healthcare workers mula pa noong April 11. Makikita din po ito ang pagbaba ng mga kaso ayon sa propesyon ng ating healthcare workers on the onset of illness. Malaking tulong ang strict enforcement of infection prevention and control measures sa ating mga ospital sa pagsisiguro ng kaligtasan ng ating mga frontliners. Tungkol naman po sa kapasidad ng ating health system na kinabibilangan po ng mga hospital beds at mechanical ventilators, makikita nyo po sa inyong mga screen ang number of beds in our hospitals. As of May 25, meron na po tayong 13,361 total bed capacity na dedicated lamang po para sa COVID-19. Makikita nyo rin po dito kung ilan sa mga beds na ito ay nasa ward, nasa ICU, o nasa isolation at kung ilang mechanical ventilators ang available. Para sa karagdagang updates, meron po tayong daily situational report released after this virtual presser which shows the latest numbers as well as the other initiatives and activities of DOH in this war against COVID-19. Pagdating po naman sa iba't ibang medical equipment at personal protective equipment that we continue to distribute to our hospitals and other healthcare facilities, makikita po sa inyong screens ang kabuuang bilang at breakdown ng mga naipamigay natin kahapon. Tungkol naman po sa emergency hiring program, kahapon, May 25, nakapag-process po ang kagawaran ng 202 facility request for emergency hiring of additional healthcare workers. 6,802 ang slots na na-approve for hiring sa 202 hospitals, quarantine facilities managed by BOQ, Philippine Arena COVID-19 Facility, and Quezon Institute Temporary Quarantine Facility. Meron na rin po tayong 2,607 na personnel na natanggap sa ospital at quarantine facilities. Nakapag-redeploy na rin po tayo ng 1,175 nurses sa mga DOH at LGU hospitals sa ilalim ng Nurses Deployment Program. 185 nurses sa Luzon at 990 sa Visayas at sa Mindanao. Heto po ang mga numero ng ating mga priority facilities accepting applications. You can send your applications directly to them. Para naman po sa pagpapahusay ng ating testing capacity, sa kasalukuyan po, meron na po tayong 34 licensed laboratories sa buong bansa na nakakapagsagawa ng RT-PCR test. We are anticipating 96 more nasa stage 3 and up na laboratories that have pending applications. Makakatulong po ang mga ito sa pagpapataas ng ating testing capacity. Ang buong listahan po kasama ang kabuang bilang ng mga test na nagawa natin kahapon ay makikita natin sa ating Beat COVID-19 Situation Report na ilalabas pagkatapos ng programang ito sa ating website, sa FB page at sa Viber community. Para naman po sagutin ang ilang mga katanungan coming from our media partners, galing po kay Grace Santa Barbara ng Manila Facebook. Kaninang umaga, sinabi po ni President Duterte na hindi magbubukas ang klase sa darating na pasukan hanggat wala pa pong bakuna laban sa COVID-19. Pero this afternoon, we heard Secretary Duque saying that it is safe to open classes this August. Hindi po ba magkasalungat ang sinabi nila? Maraming salamat, Grace, sa iyong katanungan. Tama ka na sinabi nga nitong umaga, kaninang umaga ng ating presidente na hindi niya hahayaang magbukas ang klase sa darating na pasukan hanggat wala pang bakuna para sa COVID-19. Ito rin ang posisyon ni Secretary Duque nang sabihin niyang it is safe to open classes this August as long as minimum health standards are met. Hindi po ito magkasalungat. Sinabi po ni Secretary Duque na kung masusunod natin ang mga minimum health standards tulad ng physical distancing, pagkakaroon ng supplies para sa hand hygiene, disinfection ng mga lamesa, paglalagay ng foot bath sa mga entrance ng paaralan, at pamimigay ng PPEs kagaya ng cloth mask, mas makakasiguro na ligtas ang ating mga mag-aaral. Kung sakaling magawa natin ito at ang resulta ng ating magiging assessment ay safe ang mga paaralan para buksan, we can open classes. Ngunit kung hindi natin mapapanatiling safe ang ating mga paaralan because we do not observe the minimum health standards or base sa ating assessment, it will be unsafe. Tulad po ng sinabi ng ating Pangulo, hindi natin bubuksan ang mga paaralan hanggat wala pang bakuna laban sa virus. Nais po lamang natin ulitin ang pagpapaalala ng ating mga eksperto. Hindi po dahil merong COVID-19 ay natutulog na ang ibang mga sakit. Kaya amin pong ipinagbibigay ang alam ang ibang bakuna na available sa ating mga health centers, gaya ng mga panlaban sa hepatitis, polio, tigdas, diphtheria, tetanus at tuberculosis. Sa mga sakit na tulad na meron na tayong tried and tested na bakuna, dapat hindi na tayo mag-atubili pa at siguraduhin ng mapabakunahan ang ating mga anak. Napakahalaga po na mapabakunahan natin ang ating mga anak laban sa mga sakit na ito sa lalong madaling panahon. Galing po kay Rafael Bosano ng ABS-CBN News. In their media briefing earlier, the WHO announced that it is temporarily suspending the trial of hydroxychloroquine in the ongoing Solidarity trial while its safety data is being reviewed. Will this have an effect on how the drug is being administered here? Some patients have admitted that during their confinement, they were given hydroxychloroquine. With this development, will the DOH impose the same suspension as far as using it for COVID-19 patients here in the country? Tungkol naman po sa pahayag ng WHO sa hydroxychloroquine, isang gamot na bahagi ng ating WHO Solidarity Trial para sa COVID-19, ang executive group ng Solidarity Trial ay nagpulong noong May 23 upang tingnan ng ebidensya mula sa iba't ibang pag-aaral, maging ang datos na ating nakalap mula sa Solidarity Trial. Ang executive group ay nagkasundo na anumang panghuling desisyon sa paggamit ng hydroxychloroquine ay dapat ibatay sa masusing pagsusuri mula sa nagaganap na randomized trials. Subalit dahil matatagalan ang ganitong masusing pagsusuri, napagpasyahan po ng WHO na mas mainam na munang itigil ang pag-allocate ng bagong pasyente sa hydroxychloroquine buhat ng mga adverse effects nito. Ngunit para sa mga pasyenteng sumasailalim na sa treatment na ito, magpapatuloy po sila hanggang matapos nila ang kanilang treatment. Sa pansamantalang rekomendasyon na ito, nais ipaalam po ng executive group na ito hindi muna magbibigay ng paghatol kung meron man o walang harm na naidinudulot ang paggamit ng hydroxychloroquine sa mga pasyenteng nasa ospital. Ipagpapaliban din muna nila ang pagbibigay ng opinyon hanggang hindi pa nagkakaroon ng extensive review ng mga ebidensya sa paggamit ng hydroxychloroquine. Ang nasabing review of evidences ay magaganap sa mid-June. Nais bigyang diin ng executive group na ang pagpapaliban ng pagbibigay ng hatol o rekomendasyon sa paggamit ng hydroxychloroquine ay hindi nangangahulugan na magpapatigil na ang solidarity trial at ito'y ipinababatid ng lahat ng solidarity trial principal investigators. Sa madaling salita, patuloy lang po ang ating pag-aaral upang makatuklas ng cure or lunas para sa COVID-19. Unti-unti na po tayong pumapasok sa bagong yugto ng ating laban kontra COVID-19, ang tinatawag nating new normal. Upang bigyan po kayo ng idea kung paano nga ba tayo magiging wais sa mga pagdiriwang ngayong new normal, panoorin po natin sandali ang video na ito. Para sa iba pang health tips, mangyari lamang po na bumisita sa Healthy Pilipinas website o sa Healthy Pilipinas Facebook page. Basta galing po sa mga official channels ng DOH, makakaasa kayo na reliable ang mga information na makukuha ninyo. Maraming salamat po sa inyong lahat. Mabuhay po ang mga Pilipino na patuloy na lumalaban sa COVID-19. Tandaan, together we can beat COVID-19.